Dr. Sazia, I'm so excited for you to be here today because we're going to talk about our Meno Reno, which I know is going to help so many people because it's already helped me. And I just kind of started this whole journey with you, and I'm even more excited to see down the road what happens to this face, to this body,
Right.
and thank God for you. So thank
Yeah.
you so much for being here.
It's always a pleasure to be with you, Katie. I learned so much from you. You never stop learning, right? I know my stuff. I'm still learning, but I have learned so many things from you about the business and the, health, fitness, and all these things. And thank you for inviting me today.
It's my pleasure. So let's talk about the Meno Reno. Let's tell everyone out there in Ambitchious Land how we kind of came up with it because we're genius.
We are.
High five, baby.
We are.
I will, I'm not one to toot my own horn, but toot, beep, beep, right?
Yes.
So pretty much what happened was, and I'll bring you on a little journey of how the whole Meno Reno started. So obviously we business coach together,
Right.
which is so much fun. And one thing that I love about you, there's many things, but one thing I love about you is you really understand women's bodies. And as a physician, that is so important. And I think that that's why women that go to you really trust you because they know that you're not just trying to like put stuff in their face to make them look better. It's just so much deeper than that. It's really on a cellular level, which I think is so important. And I think that, no, I mean, I love to blow smoke up people's asses, but you're definitely not one that I like to blow smoke up because it's true. Everything I'm saying. That's why I trust my clients with you. I trust myself with you. And it's just been such an incredible journey. So we were meeting one day, we were doing our business coaching, and I was talking to you about all the things that I've been going through with my perimenopause and how most of my clients are similar in age. So they're going through the same things too. And I just feel like so many physicians are not attacking this issue. One of the things that really bothered me, I was reading a study and it said the ages of women that go through suicidal ideations or even commit suicide are between the ages of 35 and 55. And when I was reading the study, I was like, oh my gosh, this is when women start going through perimenopause and menopause, right? And a lot of it has to do with the hormonal imbalances. I know when I started going through perimenopause, I didn't even know I was going through it.
Right.
I was on vacation. I had an out-of-body, full-blown panic attack. I was in another country. My husband came into the room and he was like, what is wrong with you? And I was like, I feel like I don't even know. I can't even explain this feeling. When I went home, I saw my physician and he's like, you're going through perimenopause. This is just what happens at this age, which I totally understand where he was coming from. But at the same time, it's like, are you going to help me? And he just said, no, this is just kind of like what happens.
Live with it, right?
Yeah, live with it. This is just kind of what happens, like your libido drops. And I would be like, yes. And he would just say, oh, have a glass of wine and relax. I'm like, no, it's so much bigger than that. And then at the same time, especially if, I've been in the beauty industry my whole entire life. And unfortunately, so much of all women, right? They really care about what they look like. And I don't think that's vain.
That's not vain at all.
Right? Yeah. Like when someone comes to you and is like, I just don't feel like myself. I look in the mirror. I don't even know who's looking back at me.
Right.
Which I'm sure you hear this all the time. Right?
All the time.
Do you have this happen to you a lot?
Yes. And, I can say that it happens to me as well. Right. So it's, again, I will let you finish and then I will jump on it.
No, but I love what you just said.
Yeah.
And this is why I love you so much, because you are a woman and you are at that age where you have gone through all these things.
Absolutely.
So you're not the type of person that's going to say to a client of yours or a patient, hey, this is just what happens. Have a glass of wine and relax and you'll be fine. It's so much deeper than that. So to that point, what were you going to say?
I wanted to say that, we say that live with it, right? And have a glass of wine. I admit I have said that because we have not trained properly during residency about menopause, right? So since that 2002, right, that WHI studies, and I went through my residency in 2006 to 2009. So did I learn anything? Even you talk to many OBGYN, they will say that they did not trained with hormone replacement therapy because of that study, right? But as time evolves, we know more, studies debunk that study, and now we are jumping on the boat to help the woman. We deprived our woman, including myself, from the hormone replacement therapy that will benefit all of us, right? You have to treat someone appropriately. You cannot just start hormone and let them go and do their things. No, you have to know the science, you have to know the risk, and proper management with labs and follow up, and you can make a woman's life much much better, not just physically, psychologically, and also their skin, because that's also our important part of our life, right?
Absolutely. And for the people out there that don't know what the WHI study is, it was the Women's Health Initiatives.
Yeah.
And can you talk a little bit for the people that don't know about the study and like what actually came out, and then how we were kind of sold this bill of goods about hormone replacement therapy?
So there were some, flaws into the study that, the women were involved in the study are all over 60, right?
So most of them went through full menopause. Right.
And they used, conjugated estrogen, which is not bioidentical estrogen, and progestin. So these are and they the study showed three arm, right? Estrogen, progesterone, and estrogen progestin. So sorry, not progesterone, progestin. So even estrogen alone arm, it shows improvement, not the increased risk of breast cancer. But in this and the arm that has estrogen and progestin, that shows increase of cancer risk.
Right.
So we took that endpoint and make it a big deal. And oh my god, all of a sudden a patient was on estrogen, and all of a sudden we have to stop that and let her suffer through the life, right? That's what happened. But thanks to all those provider taking their part and fighting for our right and make it happen, that now we can help women with hormone replacement therapy.
So insane. And it's really funny. I was talking to my mom about this a while back when I went on hormone replacement therapy a long time ago, right? So I've been on HRT for almost 3.5 years. And when I first went on HRT, I was telling my mom, I'm like, I feel so good. I feel like I have my life back. I feel like when I look in the mirror, I remember, I remember you. You were fun, right? And she said, oh my God, you can't take this. And I was like, well, why? And she goes, well, do you remember when I had a hysterectomy? And I was like, and obviously I know my mom had a full hysterectomy, but I was kind of like, oh, yeah, where are you going with this information? She said, well, listen, I was 29 years old and she had fibroids and all kinds of issues with her period. And the doctor said to her, listen, I think that we should just do a full hysterectomy. You're not going to have any more children, and let's just make that happen. Right. So long story short, my mom went on HRT for like 3 months. That WHI study came out, and her physician called her, and he was a great physician. And he said, Teresa, I need you to come in because we need to talk about your HRT. And my mom came in, and he said, there was just a study. I just read it, and I have to take you off of HRT because, I love you. You've been under my care for years and years and years, and I don't want to see anything happen to you because you have cancer that runs in your family.
Right.
So my mom at 29 years old with no ovaries, nothing, goes off of HRT. Now my mom is 69. So do the math, all those years with no hormones, right? My mom has osteoporosis. I was at a party with my mom when I was younger, and someone hugged her and broke her ribs just from hugging her.
Oh my God.
She's had both knees replaced, both hips replaced. She's had all these issues. My mom had terrible skin laxity. And I feel so bad for my mom because she's like, I just wish that, she'll say to me sometimes, well, Dr. Sazia gave me some Botox. And I'm like, Mom, that is not where you're going to start. Okay. There's a whole other world out there that Dr. Sazia will talk to you about because it's so far gone at this point. But I think about that and I feel so bad for my mom because I'm like, you didn't really have a fighting chance.
Right.
40 some odd, 50 some odd years, and you have not had proper hormones in your body. No wonder why you feel terrible.
Yeah, absolutely. What we recommend, right? Or try black cohosh or evening primrose oil, or, take the SSRI for your symptoms. But, SSRI cause the other side effects, right? Which we do not want to, create.
So what happens is, and I hear this a lot, I'm so glad that you brought up the SSRI issue, where women will come in, they're like, I'm moody, I'm depressed, I feel like, I don't know, just dead inside, right? This is what you probably hear a lot.
Right.
And then a physician will say, here's an SSRI, right? Here's antidepressant. And it masks the symptoms.
Right.
But then, like you just said, it causes all these other side effects. So what are some side effects when people go on SSRIs for this issue? What will happen?
Main side effects is loss of libido, right?
Yep. So they already feel like shit. Yes. And like, let's just make you even feel worse. Right. And what about weight gain and things like that?
Yeah, those are also weight gain, the loss of libido, two important things that we are fighting during the perimenopause and menopause, and we are giving the medication to create more.
It's so crazy. But I'm so glad that you brought up the study, and I'm so glad that you just said what you said, because I think there's so many women out there that listen to this podcast and they just feel like, well, this is just like the card that I've been dealt, and I just have to do it. And that's not true.
Right. That's not true.
When we started talking about perimenopause and menopause and HRT and all the things that you offer at Numi, I was like, oh my gosh, we have to do something proprietary that no one else really is doing. I mean, I know that there's a lot of physicians out there that are starting to get with it, but you are so ahead of the game. And that's why I just trust you implicitly. And I trust you with all of my clients. And of course, everyone that comes to you just falls in love with you just as much as I do. And you help them immensely. So let's talk about a little bit about the Meno Reno, but let's talk about when women come in to see you. And some of them will just come in and say, hey, I want some neurotoxin. I want to freeze my face. I feel like I'm sagging a little bit, so I want a little bit of filler. But what I love so much about you is that you don't go right there. You start to really assess it from like a cellular hormonal level. So when a woman comes in, they're between the ages of 35 and over, you know that it's that time of their life, right? Because they're starting to tell you all of these things that they're feeling and all the things that are happening to their body, to their psyche, just to their skin, all of it. Let's talk about the first step. So a woman comes in, she is telling you all these things. What is the first thing that you would do to attack these issues as a physician, but also someone who's in the aesthetic world?
Yeah. So being a primary care physician and interest in aesthetics, I can see the both world, right? So my interaction with my patient starts from, family history, their lifestyle, symptoms they are experiencing, even though they do not mention about their perimenopause because maybe they're not understanding, but asking those questions, their medical history, all these, then kind of gives me an insight of how I can help with the patient. So I ask them, do you have going through all these? They say, then we talk about what is hormone, what is peptide, what lifestyle you need to change to become a normal feeling normal person, right? So not necessarily, if you ask me, I want a filler. Yes. So this is not, filler has its own place, but this is not where I start. I try, primary care doctor, we want longevity. I care for 2,000 patient who are my part of my family. Their dad, mom is my patient too. So you kind of know the whole story, right? So that's what I kind of guide them. I can do neurotoxin, but maybe not that one you're looking for, right? And there is no one treatment I will do today will take you 5 years, 10 years down the road. It's a continuous process, right? The way you take care of yourself by doing, healthy lifestyle, exercise, you take care of your teeth, right? You have if to maintain that same way, you have to maintain your overall body and mind. Yes. So that's how we start. And then I lay down the options of treatment. Mind one thing, after menopause, your instability of the hormone kind of stabilizes. The beast is perimenopause,
Yeah.
because your hormone will bounce back during in 24 hours.
Yes.
If I do a hormone test in the morning, it's not gonna give me the whole month of your. It's that window. So
Yes.
perimenopause is the beast and very difficult to treat. Okay,
Mhm.
you don't feel like yourself. You're not gonna. You're gonna be maybe anxious or depressed, and you're not going to take care of yourself. It's like a vicious cycle, one after
Absolutely.
another.
Mhm.
And when you don't feel good mentally, then you don't take care of your physically, right?
It's so true.
And you keep yourself isolated probably from your family, right?
Mhm.
So you need to do a balanced treatment for a woman.
Yes.
And understanding that perimenopause is very, very important. And I acknowledge that I was not as knowledgeable. I'm learning every single day from my patient, from the study group, from the experts. And it's, and not one treatment fits for all, right?
Yes.
So, acknowledging your shortcoming, and again, jump onto the boat that you can help with women. How many millions of women go into perimenopause, menopause every year?
Absolutely.
You are a one single woman. Doctor cannot help everyone. There are enough provider out there to help all these women, and we should do that. We should not deprive a woman from feeling like yourself.
I 100% agree. And I can't tell you how many clients come into my office and they just are like feeling low and depressed. And they're like, I'm gaining weight around my middle. And I went to my physician and he just told me, work out more, eat less.
Mm-hmm. Mm-hmm. I've done that. But
I'm like, if I eat any less,
right,
I don't know what's going to happen.
Right.
I mean, we've all gone through that. And on top of that, no one is really, like, to your point, is looking at the patient as a holistic, full, everything is hitting the beats. And when the women come in and I say to them, well, did your physician run labs? No. Did your physician do this? No. And so when I started talking to you about Meno Reno,
Mm-hmm.
which we didn't know that's what it was
What's
going to be
really
called until afterwards. But when we started talking about that, I'm like, Dr. Sazia, you're going to help so many people. And you're going to help the men too, because
Right.
if
Yes.
their women are happy,
Yes.
then they're not going to, because like Matt was like, there was days that I could see out of the corner of my eye. He was like, oh my God, who is this monster that I married? Because it's almost like when you're going through perimenopause, you go through these crazy mood swings or things that used to not bother me.
You. Yeah, will bother you.
Like the other day we were driving to dinner and Matt had a piece of gum in his mouth and he was like, "Mwah, mwah, 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 mwah." And I could just feel like my body was just like shaking. And I just looked at him and I go, open your mouth. And he was like, what? I go, spit that gum in my hand. And he was like, are you kidding me? I go, I can't take this anymore, dude. This is like stressing me out. And he was like, you never used to, that never used to bother you. Or like, we'll be laying in bed at night.
Right.
And, he's sleeping and he's just like snoring. And I'm like, oh my God, I'm going to kill you. And I will like hit him. And he's like, what the hell? And I'm like, you're snoring. And he's like, who are you? So these little tiny things that you think are normal, they're not normal. It's your hormones, and the hormones are affecting how your brain is working, right?
And you know that, your estrogen and progesterone receptor, not only in your private part, right? It's all over your body, including your brain.
Yes.
Right?
Yes.
So that's why we feel the entire body feel the deficiency of the estrogen and progesterone.
Yes, 100%.
Yeah.
So when you have a woman come in to see you
Mhm.
and you start following the breadcrumbs, when she starts saying like, oh, I'm gaining weight and my skin is starting to sag and the things that I used to do, like working out and eating a certain way, they're just not working for me anymore. And I'm waking up at 3:00 in the morning every night and I can't go back to sleep and I'm sweating and I'm angry and I want to punch puppies, just
so sad. Yeah.
Right? When the women start saying this to you, what is the first thing that you start to do? So number one, you're like, okay, let's run some labs.
Of course. Yeah.
Right.
Mhm.
And the labs that you run, are there specific labs that you run for your people?
Yes. So, if you talk to different group of providers, right? I'm a traditional family practitioner, so there are provider in functional health as well. It's a two kind of different world. So if I am in my primary care office and they wanted to run the labs, right? There are not many labs that I can run, but I can do basic labs to check their hormones. And if they're in perimenopause but still running, having their period, so you guide them when to go for the labs to check for those, as I mentioned, right? Hormone fluctuates even 24 hours.
Yes.
So, and another thing I wanted to say, when we jump into this hormone replacement therapy world, before that, if we do the labs could be normal. Labs could be normal, and what we have said, oh, that's normal, you don't, you're fine, just deal with it. We have mentioned that.
I hear this all of the
We have
time.
mentioned
This
that.
doctor ran my labs and then they came back and he said, "Oh no, everything looks good." It's like, and I think that's even more frustrating to be a woman and to hear, like, I know that you feel horrible,
Right.
but I'm telling you that you're okay.
Right.
And then, I mean, it's I don't want to call it medical gaslighting because I don't think it, like, and I'm sure there is a lot of medical gaslighting in the, industry. So, but I'm not trying to say that that's always what it is, but I truly feel like, okay, well, now what do I do? And now I feel even more crazy because I'm
Right.
like, am I going crazy because I feel horrible, but this physician who I trust is telling me I'm fine.
Right. Yeah. So lab is not always give you the right sense of like how you're going through.
Right.
So at least if you run the labs, at least at this point, if patient is going through some estrogen deficiency and progesterone deficiency, I can start safely some treatment for them to see whether I can make them a little bit better. And having the baseline of the labs, I can go back that am I doing too much or too little?
Right.
And you have to compare the labs with patient symptoms, right? If they are feeling better, that means you're doing the right thing. Always you have to have the safety, family history, patient history, how they are doing. You do not let them just leave with that prescription and let them be on their own.
Yeah.
You have to follow along, right? What I do initially, I do frequent blood work to make sure everything, frequently see them to see whether they're having any vaginal bleeding or
Right.
anything from the treatment, so I know that she is safe. So that is, I think, provider who are doing HRT following the same protocol. They make sure that the labs are following, patient being seen as a follow-up to make sure they are on the right path.
Right.
And if they are experiencing any side effect, then you mitigate right away.
It's so interesting. I had a client who's a very close friend of mine, and she was having all the same symptoms. And I was like, girl, you need to go get your labs done. You need to go, see a physician. She doesn't live around here. She would be coming to you if she did. And she went to the physician, and the woman said to her, your labs are normal. And of course she was like, I still feel horrible. So like, what can you do? And she goes, well, we can start you on birth control. And now my friend is 45 years old. And she's like, I don't want to go on birth control. Like, we already did that in the 90s and the 2000s.
Right.
I don't want to do birth control. And then the doctor's like, well, that's all I kind of have for you. And she's like, well, and this is what I try to do with my clients is I really try to empower them to be their biggest advocate,
yeah.
because no one's going to come and save
I
you.
know.
So it's up to you as the woman who's dealing with the issues to say, okay, I'm going to study this. I'm going to read papers. And I know that people don't want to do that. They don't want to take the time to do that. But I think it's so important to just go down the rabbit hole just a little bit to figure it out. And she went back to the physician. She said, well, what about this patch or what about this pill? And I can't remember exactly what it was. And the doctor just fought her and fought her and fought her. And I said, you need to go find another physician. And she did. And as soon as she did, the next physician that was working with her was like, yeah, we're going to put you on this patch and we're going to do this cream. And within like 2 weeks, she's like, I feel like a different person.
Right.
And I think that happens a lot too. And what I love what you do is what you just said. You're not just like, here's a pill or here's a cream or here's a patch or whatever, or a shot.
Right.
Bye. you do the labs every so many
Right.
months, right? And then, like what you said, when I find the baseline of like, okay, she feels good.
Right.
She's starting to get her mojo back. Her skin is starting to get better. She's starting to maybe take off some weight that she had put on. Then you can start to space the labs out a little bit more. But when you find that baseline of that, it's a secret sauce for everyone. Because it's not one size fits all.
And if you follow the bell curve, right, of the labs, you probably wanted to see to the right side of the bell curve to have women feel better, even though it's normal, right? But patient is having symptoms, so you need to do something. Again, we were tied before, but now that evidence is showing, studies are out there, we should help women, not, this is their best time of the life, right? The kids are grown, they are settled, but they are having all these perimenopause
I know, it's
symptoms.
so not fair.
Not fair.
There's like an old saying, like, youth is wasted on the young. Have you ever heard that old saying?
I think I heard that, yeah.
And it's so true. It's like, God, my kids are off to college now, and me and my husband can travel. We have money. We have, time to take off. And then I don't want to have sex. I feel fat. I feel ugly. I don't want anyone to see me in a swimsuit. And I don't want to do this.
Right.
And so it's so upside down, but with your help and other physicians out there that are ahead of the curve that are actually helping people, it's just so incredible to know that there's people out there like you that are going to help them. I want to ask you a question about, to go back to the WHI, that study. I know that a lot of people say you can't just take estrogen by itself. You can't just take these things by yourself. You have to do these conjunctions because they're saying that the progesterone,
progestin,
the progestin. So this is why I'm not a physician. This is why Dr. Sazia is here. So the progestin has to be tied with the estrogen because that is going to make sure that you don't have these female cancers. Because what they were finding, they were correlating estrogen alone without progestin was causing these cancers to proliferate. Was that what?
So, if you take oral estrogen, right? Oral estrogen, there's many caveats to it. Oral estrogen and progestin. Remember, it is conjugate equine estrogen.
Okay, so it's horse.
Horse estrogen and a progestin. That is the problem. I think progestin is the problem. Estrogen alone did not show the increase of the breast cancer. Okay. It's the progestin with the estrogen arm that showed increase
of the female type cancers. So like breast cancer, uterine, cervical, things like that.
So I don't know whether if they did the study with the bioidentical micronized progesterone, probably would be different, right? So if I have to treat a woman with intact uterus, I will definitely do micronized progesterone. So I do not make. It's an endometrial cancer, right?
Yes.
We are worried about. So the estrogen itself that doesn't increase the thickness of the endometrium, and having the progesterone, that thickness is controlled, so you don't get the hyperplasia or the cancer.
Wow.
Right.
So that's so interesting. And who knows this? No one. Like if you're just a mom and you're like just dropping your kids off at soccer practice and you're like working and stuff, you're not thinking about all these things.
Right. We don't. I think we as a physician, in a normal hospital owned practice, or if I am seeing too many patients, maybe we do not spend enough time to educate our women.
Yes.
Right.
Yeah.
Information is out there. Yeah. Sometimes we get angry or frustrated with all the information, but I think you always have to advocate for yourself.
Right. The more you know, the better, right?
And we are talking more about the topical preparation of estrogen, which doesn't increase the risk of heart clot or all clotting factor, because it doesn't cross the liver, right? So so that is another problem or risk, which is not associated with the topical or vaginal preparation. So we are now now it's patches a shortage because we have been using it. So there is a shortage of estrogen patch.
I didn't even know that.
Yeah, it's estrogen patch shortage.
Wow. So when you put someone on HRT, like they've hit all the criteria and you're like, you're a great candidate for HRT. what are some of the different ways that women can get the HRT? Because like, I obviously have been through it. So I was given, a plethora, like you can do a patch, you can do cream, you can do injections, you can do pellets, there's all these different things. So what do you like the most?
So I tend to like cream or patch as an estrogen and progesterone pill. Okay. And for testosterone for men is a gel or the shot.
Right.
I have not, I know about the pellet, and it works for many, many women and men because, you don't have to remember to take it every 2 weeks or every day. And so that is an advantage for it. But I think when women start with something, you should start understanding the estrogen, because if your lack of estrogen for a while, now if I give you that much estrogen, right, with the pellet, I cannot take it out right away, right? You have to suffer through that, storm, right?
Yes.
But versus if I do the patch or cream, I can manipulate, right? So if you wanted to use your insurance to cover the patch or cream, obviously you can do that, right? But we also have opportunity to use the compounding pharmacy to make estrogen with estriol. Estrogen has three. Estradiol is the strongest one, and estriol is the medium, and another one is that doesn't have any effect. So you can combine these two, and you can let's say 50-50. So you slow introduce your body to estrogen so you don't go into the storm, right? Slowly going up, and how the patient respond based on the symptoms and the lab, you can dial like say estradiol 50, estriol 50, but now you do 655, 45, or maybe she's feeling too much of estrogen, you dial down, and estriol is the softer one. So you can do that as a compounding.
When women are taking maybe too much estrogen, right? What are some of the side effects that they'll come in and say, oh, I feel this way? And you're like, oh, you're probably taking a little bit too much. Are there some certain factors?
Yes, they probably get more anxious, not liking how they're, their persona at that point. And if a progesterone is high, they probably most women, I think 85%, I could be wrong, but close around, they tolerate the progesterone well, but 15%, 10%, 15% women cannot tolerate progesterone because they get more restless.
Really?
Yes.
How interesting.
Yes. So, I have not seen anyone, but I have heard from other provider that it can do that.
That's so crazy. Yeah. When I started HRT, I had no problems with anything except my testosterone was so low. And that was causing, because even though they're all different hormones, they all do very specific things, right? So, sometimes if you take too much testosterone, you get a little like aggressive, which I don't need any more of that. As you guys know, you may have hair popping out of places that you don't want hair, acne, hair loss, right? Things like that.
Horny.
What is it?
Horny.
Oh, too horny. Don't say that. Matt would be very excited for that. I'm just saying. But some people, they get like almost. I remember. I'll never forget. I was talking to one of our. She's your client. She's my client. But HIPAA. We're not going to say names here, right? And she was like, Katie, I went on HRT and I like walk in the grocery store and like every guy to me is hot, like even the ugly, not hot ones. I'm like, what is wrong with you? And then I was like, oh, like the hormones are too much for her. She's like, I haven't felt like this since I was like, 18 years old. And I'm like, maybe that's a good thing, but like, she's also not married and, she's not dating anyone right now. So that's probably like a little bit of an issue, right? Even though the man, if she was with someone, would be very excited about that. But that is an adverse reaction.
Right. And also you can have vaginal bleeding from estrogen, right?
Really? Yeah. So you could,
excess estrogen if you have intact uterus.
Interesting. So why is that? Because it has something
to
do with
hyperplasia of the endometrial lining.
Wow.
So after menopause, your lining should be less than 0.4 millimeter.
Okay.
So anytime, if you have any postmenopausal bleeding without estrogen, then you have to go for a biopsy to make sure, I have seen many women do not take it seriously, but I would highly recommend you, if you have menopause means no period for 12 months, then we call it the day of menopause, right? Then you're postmenopause. If you experience any vaginal bleeding, postmenopausal, you have to take it seriously to be evaluated by your GYN or PCP, because it could be nothing, but it could be something that you do not want to miss.
So just precautionary.
Precautionary, yeah. But with the estrogen, your breast tenderness, it will happen, excess estrogen, and then could be, if you have an intact uterus, you can have vaginal bleeding. So talk to your provider. I have a patient. I just, I'm gonna tell her. We started her on estrogen patch. After HRT, she has been suffering, but we have not talked about it. And finally, and she also read a lot, and she said, I think I have all these symptoms of brain fog, body ache, cannot fight with my weight. I wanted to try. So I said, okay, let's try it. We did the labs, and we started her on a patch because she wanted to use her insurance. So yeah. So, and all of a sudden she said, Dr. Nowrin, I'm having some breast tenderness. So let's run the estrogen. So yes, her estrogen was higher than we expect. And then we have to tweak down the, patch, and then she said, okay, it's gone. So now we have customized for her to use a half patch for 2 weeks, one patch for, 1 week, like that. And she is in a stable situation.
That's great.
Yeah. So these are the, side effects. Is always important for patient to communicate with their PCPs.
I have an insurance question, because I love to talk about these types of things. I have so many women that come to me and they say like, does Dr. Sazia take insurance, right? But I say no, right? Because you're more of a concierge type
yes. I do not take it in my Numi.
Okay.
Yeah.
But you're still a general physician.
Yes.
Because she has nothing better to do than run a huge practice and then also have an aesthetics practice and, be a mom and a wife and all those types of things. But is there an issue with women's insurance? So for example, you have someone that comes to you and says, okay, I'm having these issues, and they're coming to you as a general physician. Is there a difference between what they can get through you as a general physician and you as a provider at Numi, right? Because those are going to be two different things, because you're using a compounding pharmacy. So those types of medicines can be more particularized for that one person. Customized. That's a perfect word. Yeah. Thank you for that.
Customized for the patient.
But when they're on insurance, it's a little bit less nuanced, correct?
Exactly.
So can you explain that to people out there? Because a lot of people will say, well, I'm just going to use my insurance. I don't want to, pay out of pocket. And I'm like, yeah, but you're going to, and this is tell me if I'm wrong. This is my personal opinion and what I've seen, but they're going to have better care with someone that's going the route that as Numi compared to a general physician.
Right, because I can now listen to your body, your symptoms, and I can tweak that options of manipulating the hormone according to your need.
Through the compounding.
Through the compounding.
But when someone goes and uses their insurance, there's probably only so many different types of things that they can take, right?
Yes. So I cannot do this, compounding, like combination of estriol and the estradiol together. Right.
So it's not as a complete offering.
Yes.
Interesting.
Some people, don't get me wrong, but, patch can help you, right? Obviously. But if you want, if patch is not working, and it's an option for you to see a provider who can offer that more customizable care for you.
The other thing I think is, and again, you're the expert, but I see a lot of men, right? So my clients' husbands, because they start seeing my clients will go to you,
right?
And they'll start feeling amazing. And then the husbands will be like, well, I want to get in on that too.
Right.
So then they go to their physician and they get hormone replacement therapy, and it's always covered for men.
Men, yes.
But not for women.
No, women covered only for particular, like a patch or cream, but their formulation, right? I cannot make the formulation that
specific to that person.
Yeah.
So that's kind of,
yes, I feel like, if you, I can customize like as I would prefer that, but at least I will not be hopeless now if someone have an option to use their insurance, and at least they're not gonna be, let's say they're not gonna be 100% all to their self, but let this 50%, 60%, that's better than 0% that we use
of
not to
course.
do that.
Because
Yeah.
before I even knew you were alive,
Mhm.
thank God you're in my life now, thank God. But before, when I was going to my other physicians, I would see like men coming in for their HRT
Right.
and their insurance paid for it.
Right.
And then all the women that are sitting in the same waiting room have to pay out of pocket.
Right.
So why is that?
Isn't it always the case?
This makes me very mad.
You know, we are all mad. You know, if they had erectile dysfunction, Viagra came right away, right?
Girl,
So think
the world
about
would
it.
explain. I always say this, and I don't know if you agree with me, but it's like if you, well, like to your point, if a guy's wiener wasn't doing his thing, the world would literally burn to the ground.
Absolutely.
Right? It would be like 911. But if a woman is having similar symptoms but just different,
right,
we're still going through a horrible time.
Right.
We're just like, yeah, you'll be fine. Have a glass of wine.
Yes.
Go take a bath.
Exactly.
Relax.
Exactly. It's so frustrating. It is very frustrating.
Just, I
As
hate
a physician,
to say
as a woman, it's not fair. It's not. So you know, this has been going on and in the world, right?
Do you think it's going to change?
We always hope for the best, right? And there are strong women providers are fighting for it. So hope we will make a change.
Thank God.
We should be positive about it. Yeah.
But I just get so angry because
I know. Not only you, many women gets angry, and as a provider, you know, female provider, we get angry too.
Well, I'm glad that you said that because I have so many clients that are just like, it's just not fair. You
It's
know,
not
like
fair.
Why are we different than the men? And it's like, and it just makes me like want to be like a feminist and burn my bra.
Right. You know,
that would be bad though.
And there is, there is no like treatment protocol for women to use testosterone, right? We use the men testosterone for the woman.
Yes. Well,
right?
that's what I have to take.
Yes. See?
And at first, like when I first got on HRT, because again, they're trying to titrate, they're trying to see what's good. And I remember the first couple months, like all my hair was falling out. I was having some hair loss. And then I was like, oh God. And you almost get to the point where you're like, is this even worth it?
Yeah.
Thank God I just put my head down and I was like, no, this is going to work because I felt better, but I was having some adverse side effects. As soon as I got the perfect dose for my body, and it probably took a good 6 months.
It will be. Yeah. You know, always, sometimes you have to be patient with it. It's nothing can be fixed in a day.
Absolutely.
Right. You know, it's a very sensitive, path. You have to be patient, work with the provider, and relay your symptoms, side effects, everything, and then you will find a balance.
100%. And I'm 45, so a lot of my girlfriends, when we were in lockdown, we were all going through perimenopause. God help us all. So that was one of the worst couple years of my life because we go into lockdown, and I felt like when we went into lockdown, I was like, I feel so good about myself. My weight was under control. I felt strong. I felt like I looked good. And then the deeper that we got into lockdown, I just started gaining more and more weight. And then I just started feeling like crap. And then I had no libido. And we all know as women, when you look in the mirror and you don't feel sexy,
right?
You don't really want to have sex.
Exactly.
Even though men are like, I love you just the way you are. You could be 700 pounds and what? And it's like, no.
But you do it for yourself, right? You have to, accept, it is hard when you feel inside good sometimes, but you're not showing up.
100%. So I started feeling, as soon as I went on HRT, I started feeling better. But I will say, when you get your hormones dialed, then all of a sudden, you're like, I want to work out.
Right.
I want to take better care of myself. I want to drink more water. I want to eat better.
Right.
Because like you were saying before, it's a direct correlation.
Right.
And the uglier that you feel and the fatter you feel, and it just feel worse and worse and worse. And it just doesn't get better. It gets worse.
Right. And you get into this vicious cycle, right? Yes. It's easy to get into this vicious cycle. And in getting out of it, it's hard.
Yes. Hard. But I love that you take the hormones and then you get the women on the proper hormones, whatever, their blood work says. Right. Then when you get the hormones dialed in and say a woman comes to you and is like, listen, my hormones, I feel amazing, but my weight's not budging. That's when you start to, at Numi, you start to pull the different levers of the weight loss peptides, which I think, we've talked about this on the podcast before. I just feel like the weight loss stuff gets a bad rap.
Yes, because, again, we as a provider, we fought, right? Why do you have to take something synthetic to lose weight.
Right.
But unless you go through the stages, you will not know what that woman go through.
Yes.
Right.
100%.
So as Katie said, we always recommend, exercise more, eat less. But how less you can
I
eat,
know.
right?
Come on.
Right. But is the menopause changes everything in your body that, you're doing everything, but you're not losing anything. I can tell you countless, appointment that patient cried. They cried, say, I don't know what to do, Dr. Nowrin. I'm not losing any weight.
Right. I'm at my wit's end.
Right. And no, I was very stern. No, I'm not going to give you that peptides. No, you don't need it. You don't do
So
this,
you
do
actually
that.
fought that
For
for a
that,
while.
yeah. But
I love
then,
that. You're
yeah.
so honest.
Yeah,
That's why I love you.
honestly said, oh my God, another patient is looking for the weight loss medication. Okay. But, it is hard for most women who go through the perimenopause, menopause, weight gain, and they're probably doing everything, but they're not losing weight. And that's little dose, if that gives them a full confidence in their body, mind, and they are, now they are exercising most days of the week, eating healthy, and they look. I just saw a patient today, and she was not heavy, but she gained weight 20 pounds, and she couldn't lose weight. Right? She was trying. She's a single mother.
How old is she? Around?
She's around 40.
Okay.
And work, single mother, so
Yeah.
she works in a long hours, and I said, you don't need it. I told her, you don't
I
need
love
it.
you.
And then she said, but I don't feel myself.
Right.
Okay. So then somehow I convinced, and I started her on. Oh my God, she's a different woman.
How long has she been doing it?
She's only doing it for 2.5 months now.
Really?
And she feels great. She's so energetic. She's doing her weightlifting, exercise, eating even better than before. And that doesn't make me feel bad that, okay, even though she is not obese, but the benefit she's getting from that losing few pounds, the motivation she's getting to do more, better, lifestyle for her.
Yes.
Why not?
Right. Because it's a chain reaction. When you start
Right.
feeling better, the weight starts to come off. You're like, oh, I want to go to the gym. I want to. And it's just this whole snowball effect,
Right. And we actually, I think it's like if people are not saying that they're taking the medication because of that taboo that, she's doing it, that she's an Ozempic face, so she's doing it. But, this medication has been, I was listening to a podcast of a weight, obesity specialist, and she said, this is the medication we should invest, because this is the medication gives you the best, result, other than, signing up for the, meal plan.
Yes,
That's not easy.
No.
Expensive, right?
Right.
And also I have friend who like not alcoholic, but
She likes to have some wine.
Right. And she said, I don't feel like it, because you don't get that reward.
I have heard this
Right.
so much. I was
Smoking,
actually going to ask you
yeah.
about this because it works in the same axis
Right.
of these like habitual, like drinking, gambling, all
everything.
that
Yeah,
stuff.
because you don't get the reward by this medication. I have a
Right.
friend who is a physician too, and she's on it because she has positive gene for dementia, and her mom has a dementia, so it prevents.
Of
So,
course.
and so she said, as long as I can, I will just continue taking it.
Why is the weight loss medication like neuroprotective?
Exact mechanism I will not able to tell you right now, but it
I don't think a
does
lot of people know, by the
know
way.
about it.
Yeah.
But study, I have to.
Yeah.
Sorry, I didn't
No,
read the study. Yeah,
but now I'm like, I'm
Yeah.
interested in it because there has to be some reason
think
why it's protecting your
yeah,
neurology.
it's doing so many things that it's more incoming, and I hope to pray that in long term we don't see any bad outcome,
right.
and all these positive things that keep going and giving women, men, and benefit of this medication.
Well, it's so crazy because, my mom was in geriatrics before she retired. So she worked with a lot of population people that had Alzheimer's and dementia and different type of neurological, age-related neurological disease. And I remember listening to a podcast one time, and the doctor was saying that they're calling dementia type 3 diabetes.
Yes, I heard that.
Because they're saying that there's a direct correlation with people eating a lot of
sugar. Yeah. Sugar actually,
causes
Katie.
inflammation.
Yes. So sugar is the culprit for everything.
It's the devil.
It
tastes so good, though.
So good. Yeah. But it's the inflammations. The inflammation causes many other cascade of reaction that affects the body.
So really, truly, inflammation is the root of all of these issues with with perimenopause, with menopause, because I don't know when you went through what you went through with your perimenopause and menopause. As soon as I started going through it, I just felt like so bloated and
so bloated.
Big, and
yes.
my head, I had this big head.
Right.
Like your face gets fat and everything just looks big.
Exactly.
And you feel big.
Feel big, rounded.
Yes.
Like I cannot explain.
Like you put on your pants to go out to dinner and they fit, and then all of a sudden after you eat a couple of bites, you feel like I just want to unbutton my pants. I'm like, who wants to live like this?
Absolutely.
Like I just want to live in a muumuu for the rest of my life, but I don't want to live like that either.
Yeah.
But I think it's so interesting because a lot of people, and I've heard this so much, I've seen it on social media, I've heard it from people I respect, that they're like, oh, taking these weight loss medications is the easy way out. But that's not true, because if you're doing it the right way, and I know that you tell your patients and clients, you have to eat right. You have to hydrate, you have to move your body, and you have to lift weights. You have to do resistance training.
Exactly. The way we tell our diabetic patient, medication is another tool besides your diet and lifestyle. It cannot be only a tool. Same thing with obesity is an epidemic, right? And obesity can cause a lot of cancers, right? So, and think about the cost of healthcare from the obesity, right? With the chronic health problem,
all of this obesity caused from obesity.
And if this medication can help you to reduce that, that obesity, why not? We want a perfect profile, right? You manage the patient's labs, make sure they are not contraindicated to take the medication, and they are just not relying on the medication, doing the other things. Like exercise is the one most important thing that can prevent your cancer, your heart disease, and everything. So just do not rely on the medication. Do your other important lifestyle changes, which is so important.
So true. The other thing I think is really interesting about peptides as well is that people think that these things just came out of the air, like this scientist was in a lab and found this thing. But no, peptides are naturally occurring amino acid chains in the body. So GLP-1, GIP, and then we have GLP-3, which is like the glucagon, right? That's the third. That's what the retatrutide, which Eli Lilly right now is trying to patent, right?
Yes.
So talk a little bit about each one. So semaglutide, or what is the is it
Ozempic?
Ozempic is semaglutide.
Right.
So that's a GLP-1.
Right.
So that is its own branch chain amino acid profile. And then you have GLP-2, which is the tirzepatide.
There's a GLP-2, which is GIP, and GLP.
So it's a double agonist.
Double agonist. Okay. And then we have the retatrutide, which is triple agonist with glucagon.
And they say that's going to be it.
Yes.
That's going to be like the holy grail. Weight loss. And on top of it all, I've been reading, because I'm a nerd.
Yes, you are. I think peptides more. I have to acknowledge, admit, peptide more than me.
Well, you are so good at what you do, and I can give you a couple little pointers every so often. But my story with peptides. I've healed so many different issues that all came because of perimenopause. Because what is the triple threat of perimenopause in women? Frozen shoulder. Yes. Joint pain and plantar fasciitis, which I had all three. And as soon as I started taking peptides, within days, I was felt like a different person. So I started the HRT. Then I got on the peptides, not weight loss peptides, more healing peptides. And then on top of that, now that this retatrutide is coming out, hopefully soon. Right? Hopefully soon. I was reading a study that said that whatever the end stage of fatty liver disease, so not caused from alcoholism, just
so being overweight and not having it's a metabolic syndrome,
right?
That can cause fatty liver disease,
and that's horrible.
Fatty liver disease can turn into a cirrhosis in a long term of the liver. So you do not want that. So you do not want the metabolic syndrome to affect your body. So that for that, exercise, eating healthy,
Right.
all these can help. So,
but the retatrutide, they in the study said that they had all these patients that had the stage whatever fatty liver disease, non-alcoholic, and within 4 weeks it totally reversed.
Yes,
taking retatrutide.
That's what I heard. So
amazing.
hopefully it's amazing. Yeah, hopefully this will be.
And they're also saying that the retatrutide is going to keep the muscle, because that's one thing with like the GLPs and the GIPs is the like, and I've seen both sides of the fence.
I have seen too.
Right.
Yeah.
I'm sure you have patients that are like, they're working out, they're eating right, and they're taking the meds and they feel amazing. And then you have the women that are like, I'm just going to sit on my butt and take the shot and then blah, la, 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 la.
Right.
And that's when you see these women who have the Ozempic face, right?
Yeah.
This is like a thing that they're calling it, which is laxity of the skin.
And also muscle sarcopenia, right? Muscle loss.
Right.
Yeah.
So they're not eating enough protein. They're not working out. So now they're losing weight on the scale. But I would rather be heavier on the scale, but look good.
I think, it's a psychology. When people are heavier all their life, I think the numbers play a trick on their brain.
Yes.
I think that is part of it.
I also think it's generational.
Right.
Because like your daughter, she's Gen Z, right? And my stepdaughter is Gen Z as well. And they're like body positivity, right. Like you're beautiful at every size, which I wish that I grew up in that era.
Right.
Because we grew up in the era of like fat-free cookies,
right?
Work out 3 hours a day, like do all this crazy stuff. Like we were probably all anorexic, going through anorexia nervosa, and we didn't even know. Right. So I think that if you can take a medication, do the lifestyle changes, not abuse it, and then also take care of your skin, and we're going to talk about that in a second.
That's how Reno comes, right?
That's where the Reno comes in. So we wanted to give you today all this information, which is so important because, again, it's the advocacy, right? People, I don't want people just because someone, and please don't take this the wrong way, but just because someone's a physician does not mean they know everything.
No, it cannot be.
Right?
If I say that I know everything, then I'm doomed.
Yes. Yes.
You learn every day. You learn from your patient. You learn from your peers. You learn from everyone. So, and medicine in an aesthetics is constantly changing, and you need to keep up with your knowledge about. I may learn something yesterday that completely changed maybe tomorrow based on what 100%. Studies and all these things. I do agree that you learn every day. You, as a physician, you may not, I'm a primary care physician. Do I know in depth of every cardiology or nephrology? No.
Well, that's why they're specialists.
But yes, that's why they're specialists.
Right.
I'm the gatekeeper for my patients to do their basic thing and to see the right
right. You need to go see a cardiologist. You need to go see this person.
Right.
So that's really awesome. Now, as far as the skin stuff goes, because this is when we get into the Meno Reno part. So you got your hormones dialed in. Dr. Sazia's got your hormones dialed in. Then maybe you're taking a peptide. Right. Maybe you're taking one of the the weight loss peptides. You're feeling good. Then what happens is, and this is what happened to me. So a little backstory, you guys know, I have genetically, thanks mom and dad, but I genetically have always had a weak chin. Okay. And I've done pageants my whole life. And even when I would get so thin to compete, I'm talking like 10% body fat. I never had a sharp jawline. Now, back in the 2000s, no one really cared about that.
Right.
But recently, maybe the last like 10 years, it's all about like the snatched jawline.
Our Hollywood jawline. Yes.
Well, guess what? I didn't have a Hollywood jawline. I had a John Candy jawline. Okay.
I know it's some people it's a genetically, like my daughter has the same thing.
Right. We just got a little chin, and my mom has it, and my grandmother had it, and my sister has it, and that's just the way it goes. So years and years ago, because I've always had this issue, before I met you, I was going to a nurse injector, and this is when Kybella first came out. Do you remember Kybella? Do people still use it?
I think they do, but not
But you
as
don't
often.
do it.
I don't do it.
That's not your thing.
No, that's not.
Like, I've never heard you talk
No,
about
no,
Kybella,
I
unless
don't
we're
have
like
Kybella.
talking shit about it.
Right? No, I don't have Kybella.
Because I call it Satan's urine. It's because it hurts.
It hurts.
So
I
bad.
heard that. Yeah.
So I went, and she was like, "Oh, there's this new thing that came out. It's called Kybella," and I was like, "Do it," because she's like, "It's gonna get rid of that chin," and I'm like, "Thank you, Jesus." So I go. And they do this little map on your neck. It's like a little sticky thing.
Okay.
And when it's almost like a tattoo, like the
Okay.
little tattoos you see
Yes.
when you're a little kid. and it puts all these little dots on your neck. And where those dots are, that's where she
She
injects the
injects
Kybella. So she's like, okay, no numbing.
Okay.
No numbing.
Okay.
Okay. And listen, I have a high pain threshold.
Right.
Dr. Sazia is always like, is this hurting? And I'm like, no, is it supposed to hurt? And she's like, what the hell's wrong with you? You're sicko.
Right. Yeah. You can tolerate pain pretty bad.
I'm pretty good, right?
Yeah.
So she starts injecting me. Within the fourth or fifth injection, I was like holding onto the chair. I was like shaking. I was like, because it literally feels like someone is taking a blowtorch and burning your neck. But then you need 25 more of those shots because there's like 30 shots or whatever. I'm probably totally making this up. So if you do Kybella, don't come for me and be like, bitch, you don't know what you're talking about. But it was a lot of shots. She can't stop. She can't just be like, oh, I did 10 and I can't do the rest. Like, so I had to go the whole thing. Now, mind you, when you do the Kybella, your neck blows up like a bullfrog.
Right. I saw one woman. So yeah.
A bullfrog. Like I literally had this huge thing and it was in the wintertime because she's like, we're not going to do Kybella into the winter because then you're going to wear turtlenecks and scarves to cover your neck because it's going to be, I'm like, okay. It was so painful. It was so ugly. And then when it started to go down, it did nothing, literally nothing. Okay. So I'm like, I'm going to have to live with this damn chin for the rest of my life. Then you start saying, okay, well, maybe if I get a little filler and I make my chin longer, then that will be better.
Right.
No.
Right.
Because it's all about balancing.
Right.
Right. So Dr. Sazia has this incredible thing called eye laser.
Right.
And you had just started working with it. And you're like, hey, I have this thing for your chin. And I was like, what is it? And she told me, and I was like, you know what? Nothing can be worse than Satan's urine, Kybella. So I'll do it. So we went in.
Right.
You do a little numbing. So you do it's almost like getting when your teeth numbed.
Right.
When you have like a cavity or whatever, filling. So we were doing my chin. So you did an injection on both sides of my masseters, right? Right under?
Yes. Right under the mandible.
Okay. Right under the mandible. See, this is why we have the doctor here. And then you did a little bit down here. And it's this little
fiber. So I can take it from it. I can say.
Please. Because
so
I
we
will
numb
it.
first on the skin and then we numb the whole area.
Okay.
So you should be, anyone who do eye laser should be comfortable.
Yes.
Right. Another day, and one of patients said, I could fall asleep. That's what she said. Okay.
Wow.
So yeah.
Who's this sicko? I want to meet her. We'll be best friends.
Yeah, if she's a very young woman who came for the same thing for the under chin. So then it's a fiber, like fiber optic, but
it's so thin.
So you can use it without a cannula. Cannula just guide us in a proper. So
a cannula is like this little tube and then the fiber goes through it.
Okay. And that cannula we introduce.
Listen, she's a doctor. She's on call. So if you hear the phone, that's why. It's not because it's not her OnlyFans.
Yeah. Sorry.
So back to the cannula.
Yeah. So then you introduce that cannula to the area they are treating. So for you, what Kybella is supposed to do, burn the fat cells, right?
Allegedly.
Yeah. Burn the fat cells. So, and it cannot be back.
And then your body just like you pee it out.
Pee it out.
Okay.
It goes through your lymphatic channels and you pee it out. On top, when we, burn those fat cells, the skin get looser, right?
Yes.
Right. And then with the same setting, like same session with the same device, we do the skin tightening. So that's what we did for you.
Yeah.
As our Meno Reno program.
It's amazing. So when you actually, because I was obviously having it, but I've seen you do it on other people and a chicken.
Yeah. So
remember when we did on the chicken?
Exactly.
So Dr. Sazia had literally a full like roaster chicken.
Yes.
Like not cooked, obviously. And she was showing us one day with the chicken how it works. And I was like, come on, this can't be. I was like, oh my gosh, like, who invented this? Jesus, God, someone. I mean, it was incredible. So what they do is first you do the fat dissolvement, right? So you abolish the fat.
Right.
Then you go in with is it the same
fiber,
but just a different setting?
Yeah.
And then as soon as you change the setting, it all of a sudden it goes, "Meep,"
Right.
and it just pulls your skin up.
Skin up, yes.
And I swear I wouldn't have believed it if I didn't
Didn't
see
see
it
it.
on someone else or
Right.
the chicken.
Right, exactly. And the immediately you see that, when you hit the plastic, you see it contracts. That's how
Yes.
its skin contracts initially. Then over the 8 to 10 weeks, your body produce collagen and elastin, and it's tighten up even more.
Mhm.
So
When I went home that night, I had no pain. 0. And I didn't really even feel pain when I was getting it done. Like, you kept being like, "Are you okay? You all right?" And I'm like,
yes,
"I'm fine." Now, there is sometimes a slight smell.
right.
It smells a little bit like
Fat.
Doritos or
True.
maybe like a Taco Bell energy. Not that I've ever had Taco Bell before, but it smelled a little taco-y
Right.
because it's actually
Take
heating.
heating, yeah.
And you hear a little bit too. It kind of goes like,
Yes, you can hear that.
so if you're
yeah.
like one of those people that like you're like freaked out by that,
Yeah, we can put the
the little
music.
earplugs,
Yeah,
right.
yeah.
And I went home that night, and you gave me my little chin strap that was
Yes.
very sexy.
Very sexy.
And I
Sorry.
wore that all like for days.
Right.
And it was nice because I just said, "Okay, Dr. Sazia, I'm going to come in on a day where I don't have anything to do for like 3 or 4 days.
Right.
No one has to see me in the chin strap.
Right.
Okay." And I just kind of hung out my house. I did my CO2 mask that you gave me. I just kind of took it easy. And honestly, I think it was like we did it on like a Thursday or Friday.
I think Thursday, yeah.
And then by like Monday, I was like back at work, and no one even knew I had anything done.
Right.
Of course,
Oh,
I
so-
talk about it,
Right,
like because all
exactly,
my
yeah.
clients are like, "Oh my gosh, tell me about your eye laser or whatever." And I was right back at work, and no one even knew I
Right.
had no swelling. It was really
Yeah, I
amazing.
think you take care of your skin so well with healthy lifestyle and
Right.
everything, so you didn't swell up a much. But
Mhm.
not everybody will be the same as
Right.
you. We have ranges of people can have like our other client, my other
Yes.
client. Oh my God, she's better by third day, even better than
Incredible.
you.
Yeah. Oh,
Right?
no, I was jealous.
Yes, I was. She was like, I think you are an
She's
outlier.
probably listening to this podcast right now. We're
Yes.
not going to say her name because of HIPAA, but I was so jealous. I was like, like within days, I'm like, who
Days.
is this person?
Exactly.
And she didn't look bad to begin with.
No,
But we
yeah.
all could use a
Right.
little something every so often.
Exactly.
So with the eye laser, you can pretty much do your entire body.
Entire body.
So
I'm telling
you can do your arms.
Your belly,
Yep.
your brow,
Yeah,
fold,
the back fat.
your
Mhm.
flanks, your thigh, loose skin in your above knee.
Wow.
You can do that.
So if someone doesn't need the fat to go away, if they just want the tightening, you can
Just
just do the tightening setting.
Just do the tightening. Yeah. Just do
Wow.
the tightening.
That's so amazing.
That is an amazing. Yeah.
How many times can I do it?
So it's
Because it's
depends.
addictive.
Yeah,
'Cause
I
you're
know
like,
addictive.
this is
yeah.
so there's no downtime. It's not like, and this is another thing, because we were talking before the podcast started today, and I was saying one of the biggest things that I don't want to do is I don't want to be like 40 years old having a full facelift, because I have a lot of friends,
Mhm.
no offense to them, love them, they look beautiful, but that's that's invasive.
Mhm.
You have to go under anesthesia, you have to stay in the hospital for days. I mean, that's a lot,
Right.
with something like this. And this is what I think that every woman should start doing as soon as they hit, maybe even
Right.
before, but I
Right.
say as soon as you start going through perimenopause and everything, like you were saying, the collagen starts to go away. All these different things happen to your skin. So if you can do these little non-invasive things and stack those and then put off those, deep
Invasive
plain
things.
facelifts
Right,
until you're older.
Right.
I mean,
Right.
that is kind of your whole
Right. Prevention. I'm a primary care, right? That's my route. So prevention is everything, right? You want to prevent cancer. You wants to prevent your skin laxity, right? Some are genetics. I know we cannot, change that,
right.
but you can change a lot of things in your hand, right? How you live your lifestyle. So exercise and eating healthy comes, right? Taking care of your skin, like you
Getting
brush
good
your
product.
getting good product, medical grade product.
God, these
you know.
girls are like, I'm using saying
Right.
that it's apricot scrub. I'm like, honey,
Right. And
1989 called. You can't do that.
Right. And you don't have to like 13 steps of your routine. You
Right.
can have few meaningful actives in your skin routine, and you can and nothing will change in a day, right? You have to do it every
You have to
single
be
day.
diligent.
It's all consistency, continuum. All these matters to your well-being.
Yep.
Every part of your body.
So tell me how many times I can do this.
I think I can
To
do
my
that.
chin.
Yeah. I think
we need another.
I think I should do a lift only.
Tightening.
Yeah, tightening. Yeah. I
Good.
don't have fat.
The thing is, if you
Yeah.
guys, I wish you could feel my chin. I don't have like a fat
No,
chin.
you don't.
I don't have a
right.
chin. There's nothing
Yes.
there. The
So
bones.
so we can do the and
Pull it up.
Pull it up. Yeah.
So I don't need any tape.
No. And when I touch your under chin, Katie, I don't feel fat.
I
It's
know.
just the skin.
It's just my jawline is
So
sad.
we can again. I told you, and I tell everyone, sometimes, when you treat someone for diabetes, right? One medication doesn't work, you add the second one, right? Same thing with, hypertension or high blood pressure. One medication doesn't work, you take second or third. So for Meno Reno, right? Or for our achievement to tightening lushness of the skin, we have to combine multiple modalities.
Yes.
Our goal, more elastin, more collagen. So if one cannot give us, we resort to the second one or third one, and combination, stacking. That's how it comes to have a healthier looking skin.
So in between your eye laser treatment, so say you're just treating one area. So for me, it's my chin. What is the usual time period in between, like getting it done, recovering, and then having a second or third treatment?
So I would say, like, final result, we wait for at least 10 weeks, right? So I would say I can go back and do it in 3 months.
Right. Because I think we did it in November.
Yes.
No,
December.
December.
Yeah.
So now we're doing this podcast in May.
So 6 months.
I'm overdue. See, thank God for her.
But we did something else.
Yes,
right?
I want to talk about that too.
Yeah.
And I want to also bring in the stack, because the word stack just kind of like clicked in my head. So we did the eye laser. And then a couple weeks ago, about a month ago now, I went in for a CO2 laser.
Right.
And because I have Portuguese ancestry, even though I'm very light skinned, I get very dark, like in the sun, but I also get super hyperpigmentation. Like if I have a pimple and if I pick at it, which I try not to, but every so often I get a little, crazy with I call it the bathroom surgeon. You go in there with all the little tools and stuff. And every time I'm like doing it and I'm like, oh, I love it. And then all of a sudden 3 days later, it's just this purple mark that doesn't want to go away. So to that point, what do we do?
So we pre-treated your skin for a month with the hydroquinone. So that
I love that stuff. I want to be on it all the time.
No, you can't.
I know.
Only 3 months.
It just makes your skin so like, I don't know.
I know.
It just does something to it. It just like takes out that darkness, right?
Out, yes.
So we pre-treated for what, couple weeks with the hydroquinone?
I think more than that, right? For Katie?
So. Oh, maybe like 4 weeks.
I think I did 4 weeks for you.
Okay, so we pre-treated with the hydroquinone. Tell us why you do that for women of color.
Right. So just to, I could have done without it, keeping your setting. So CO2 laser, more safe, skin type. So we have skin type 1 to 6. So 1 to 3 is more safer because they don't have that much of melanin, right?
The white ladies.
The white ladies, yeah. So for me and for you, I cannot do CO2 laser safely, like a higher, strength, because the hyperpigmentation, right? So if I wanted to CO2 laser, yes, I can do it, but the one that is very low setting, so I don't get, and I can do pre-treat my skin to be on the safe side. If someone is very prone to hyperpigmentation but you want to get the benefit of the CO2, pre-treat yourself, and so that you are not, your melanin are not producing melanocytes, overproducing melanin. And after CO2 laser, when you done healing, you could go back to use it for another couple of weeks.
You see all these people like on social media who have had like really adverse reactions to these lasers, and they're very ablative, right? These people are going like hardcore ablative. But I was watching something on Instagram on a reel, and this girl was like, she had all like these grid marks all over her face, and they were not going away. And then come to find out, her mom was Spanish. The doctor must have not had taken that into consideration and pre-treated her, right? But with you, we did the pre-treatment. We did the lowest setting of CO2 laser.
Right.
People are like, did it hurt? I'm like, no, you
I
put the
numbed you
numbing
for
cream on.
an hour. Yeah.
Yeah. Well, we shot the shit and you
Right.
put the numbing cream on me, and it was so quick. When you start doing the laser, it just goes by so fast.
Yeah.
And people say, well, what did it feel like? I said, well, when the numbing started to wear off, it kind of felt like a sunburn.
Yes.
Like it just felt like I just fell asleep in the sun at the beach and I got a sunburn, right? But the next, you gave me the CO2 mask, which I put on at night before I went to bed. And the next day I woke up, there was no pain.
Yeah.
It just kind of gets tight, gets a little like sandpapery.
Right.
But when that skin starts to peel, honey, it is like a baby's bottom.
Absolutely.
When she came to my house today to podcast, she's looking at my skin and I go, I want to do like 100 more. I said, Dr. Sazia, if you just tell me, don't go on the sun the whole summer, I promise I won't, because what it did for my skin in one treatment on the lowest setting blew my mind.
Right. I think you should do like twice a year, just as a maintenance.
Okay.
And
that's good. That's good. That's
good
information.
Right. So one new study shows that even one CO2 laser treatment increases IGF-1 growth factor that we all had as a high amount as a baby and young.
I remember those days.
And it's plummeted as go down.
Like
so
everything,
right? And it increases the number of the IGF-1 growth factor that.
So it's almost like you're going backwards in time with your skin.
Right.
It's so amazing.
It is amazing. And sometimes I feel like, oh, why not? I'm skin time 1, 2, 3.
I know, but you said you did your own.
I did. So CO2 laser machine, I was very hesitant to bring onto my practice, because if I cannot use it, right?
What's the point?
Point?
Selfishly, we want to also use the stuff that we buy, right?
So the device from Monarch, they have a Deca platform, and that you can dial it down. So lowest. So your minimum could be my maximum.
Got it.
Right. But but that will give me the result of any other like skin type 3. So once I could tolerate that without hydroquinone and without having any hyperpigmentation, so I said, you know what, I'm getting that device for my patients.
And thank God you did.
Yes.
And I know it was expensive, but it's worth every penny.
Exactly.
It really truly is.
It truly changes the skin.
So when someone like me who has the type, what type am I?
I think you still type 3, but because of your Portuguese thing, I kept you like a 4.
So someone like me, I go 2, 3 all together to get the best, and then you do once or twice a year after that as maintenance.
As a maintenance, yeah.
Because I think that's another misconception is people say, I'm going to do this one time and I'll never have to do it again.
Nothing in this world can fix you in one time.
Even a deep plane facelift, these women sometimes have to go in for revision, right? Because your skin's still sagging and growing and doing what it does. So on top of the CO2 laser and on top of the eye laser, what else have we been doing? So we've been doing microneedling.
Microneedling, yes.
So why do women want to do microneedling, and how many times a year can you feasibly do a microneedling treatment?
So, if it's just plain microneedling, it's not going to hurt if you do every quarter.
Okay.
Right? What it does, it control injury to your body. So your fibroblasts get, knocked on the fibroblasts, so it produces collagen, right? That's what it does, right? So if you have, significant laxity, and you can do that. And remember, we lose collagen 1% every year since late 20s. And sun exposure damages higher. And after menopause, you lose 30% after 5 years. So you're not going to go back to your 20s collagen, but you can get back some and make your skin look healthy and, feel it feels good when your skin feels good.
Absolutely, 100%. And for all of us elder millennials and Gen Xers, we were all tanorexics.
Right.
I used to go twice a day tanning. Are you kidding me? What was I doing?
I don't know.
I can't believe I don't have more sun damage because of how much I tanned. Thank God I have a little bit of the Portuguese, blood. But other than that, every girl my age should be getting this.
Right. And I have a question to you.
Tell me.
Going back to the peptide.
Yes.
Have you talked about melanotan? Yeah.
Yeah. I haven't taken it yet. I don't really care about being tan anymore.
Okay.
But I have a lot of friends that take it and they're so tan.
Okay.
And it's just from taking a peptide. It's not from going out in the sun.
Right.
But the one thing that I heard about that is it's almost like a niacin flush.
Okay.
I don't like that feeling.
Okay.
Have you ever had that before?
No, I heard it, but it's like
it's this weird feeling, like it comes from the tips of your toes, comes up your body. I can't even explain it. It's just the weirdest feeling, and it makes you feel like woozy and a little like woo. But if someone wants to be tan, they'll deal with it.
But there is a risk of melanoma.
I heard this too. They're saying there's all these things that come out. That's why I never really got into it. I think if I was still competing in pageants, like back in the day, and we always had to be tan, and like even like black girls would go tanning, or they would have spray tans to like, because it makes your skin look better on stage under the lights and all these types of things, the things that we did. But yeah, it's called melanoton.
Melanoton.
Or melanin.
Something like I always have a tongue twister about it.
But all the peptides, there's like 3 different ways to say them. Some people like call like epithalon, epidolon, all these different things. So sometimes I'm like, what are they? Or retatrutide, they'll call it like whatever.
It's easy to say Retta.
Everyone just says Retta. But yeah, I think it's so interesting. And all it does is it just works on your melanocytes. Right. So it makes your melanocytes just produce more melanin. Yeah. It's just so weird.
I know.
We're living in crazy times. It's like a science fiction movie, isn't it?
True.
But I do love the peptides, but I don't, the other peptide that made me feel like that, and I hate it, Samorelin.
Okay.
And I have so many.
But isn't it Morelin should be lesser than the Tesamorelin?
So Ipamorelin's the highest.
Okay.
Tesamorelin's like middle.
Yeah.
And the Samorelin's like the lowest. A lot of my clients take it for sleep.
Right. That's what I heard. Yeah.
Sleep.
Yeah.
But it is a secretagogue to growth hormone.
Yeah.
So what it does is it just tells your, pineal gland or pineal gland, however you want to say it, to just produce more of your own growth hormone instead of getting exogenous growth hormone, which back in the day, all of my bodybuilder friends and me took synthetic growth hormone to lose weight and to get really, really ripped for, pageants or even, bodybuilding competitions. But, there's Jacobsen-Creutzfeldt syndrome you could get because where they were getting the growth hormone was from bovine pineal glands. Right. Yeah. Which is, what were we doing? See, you're like, Katie, don't even tell me this. About she's like, I'm a physician. I want to hear this. But I mean, this is the world that we live in. People want to biohack. They want to just, maximize. And I think that's another thing too, because what you're doing, you're helping women biohack without turning into like biohacking nerds.
Right.
Which is so important.
Yes. Informed choice.
Yes. But the Samorelin, when I first started taking it, I would get these like welts, like, cause I would do it subcutaneously in my stomach mostly. And I would get these like huge welts all over my stomach. It was like a histamine reaction, which happens in a very small percentage of people. So I would just be like, okay, just who cares? It's itchy, whatever. One night I took it and I thought I was going to die. Like I felt so sick. I was like, I couldn't walk. I was like dizzy. And Matt was like, are you all right? Like, stop this. So when people come to me and say like, hey, I want to do Samorelin, I'm like, this was my experience. Doesn't mean it's going to happen to you. I have a couple of my clients now through my medical director who does the peptides for me and my clients. I have one on it. She's like, I swear by this. It has helped me, put on muscle. I sleep like a baby and I don't have any adverse reactions. I'm like, God bless you.
Right.
But for me personally, I don't love that. And I started doing research on it because, I have to like figure it out. And a lot of times they say that when you take these secretagogues to growth hormone, if you have damaged mitochondria, which who doesn't,
right? If
you're over 40 years old, what's happening is the powerhouses of the cells are not working properly. So you're having this kind of like contraindication with the Samorelin. So what you have to do is go on a peptide that first fixes your mitochondria, right? like a MOTS-C or epithalon or pineolon or something like that. But not many women are going to be like, I'm going to give myself 10 shots a day.
Right. That's true.
I'm a special.
Right.
I'm a special case.
Right.
I think that I have like a death fear. I think like most people do, but I was always like obsessed with like not getting old and not dying. Maybe I don't know what happened to me in my past life. I have to go talk to someone about that. But when I was younger, I was like, I just want to be as pretty and as happy and healthy as I can for as long as I can. So that's why I really started getting into the peptide stuff and, you know, the HRT and all that, but it's not for everyone.
Right.
And I do not push it on anyone.
Mm-hmm.
I try to be a good role model where it's like, this is what I'm doing. And if you want information, I'm more than happy to talk to you about it, but I don't ever like push it down anyone's throat. And you're the same way with what you do.
That's not gonna work. Like, it doesn't work with even kids if you force anything.
No, it's the opposite.
Right. You know, someone has to convince that it is benefit, risk, and they're committed to do it.
Absolutely. And then obviously on top of everything else, like you do my neurotoxin. So what do I do?
You do Juvo.
Yeah. People always say Botox, but Botox is just
the grandfather type.
Right. It was like the first one.
It's all the neuromodulator, botulinum toxin. So that's a different, brand.
Right.
Some are more potent than the other. And there are a couple of, it's with peptide like Daxify.
Yep.
And, they are peptides, not a protein. So, and so there are newer versions coming.
Right.
Every so often.
It's so cool.
Right.
And then as far as like filler goes, once you get to the place where you're like, okay, I've done my eye laser, I'm on my HRT, I'm taking my peptides, I'm eating right, I'm working out, I'm drinking my water, I'm trying to get 8 hours of sleep a night. Then you can start getting into the more aesthetic stuff, which is really, it's like the neurotoxin. And then the second is any filler.
Yeah. So, as you're balancing your hormones, so that's gonna help your skin as well, right? But it's not all. So you have to have a skincare routine with a good medical grade, some actives that has meaningful improvement plus, and you do have to have a maintenance, like you go to a dentist, every 3 months. You probably wanted to have a medical grade facial or medical grade, or microneedling. You can pace it out. Our goal is to get you more healthier and hydrating skin, youthful skin. So these are right. So for you, let's see our Meno Reno, right? For eye laser, we achieved goal, probably not 100%, but let's say 75%. And then we CO2 lasers to improve your texture, tone, and all these, right? Also some tightening as well. So now after looking all these, then we have to go back again to tightening. Most of the time eye laser one is enough, but depending on, sometimes you do not want to hit the tissue too much, then it causes more swelling at the one incident. So for you have to go back. And if we achieve the goal and you're happy, then we don't have to do anything. You just maintain your microneedling, your CO2 laser, your neurotoxin. Every 3 months for neurotoxin, microneedling you can do every 3 months, CO2 laser twice a year. And if I feel like, okay, let's do a little bit of filler to extend your profile picture, and that's it.
See, and you know what I love too about what you do compared to so many other injectors or doctors that are in aesthetics is you don't want to make someone look like not themselves.
Yeah, and this is me, right? If I'm natural, my patient will be natural.
I've been studying this a lot lately because, that's what I do. And what I have been seeing, just, I don't know if it's just a curve that's happening or whatever, but all of the big lips and the overfilled faces and all this stuff, that is so going out of style.
Absolutely. I'm so glad.
Me too.
And I'm glad that I came to aesthetics when regenerative, preventive, and this is coming, biostimulatory, these are in the, and I think that's, I can deal with.
Yes. Because to me, in my opinion, this is the future of aesthetics, is the longevity. And it's not like, let's make your lips huge. And, I have friends that they don't even have lines in their lips anymore.
Right. But that's normal, right? Little bit of lines.
I mean, you need some lines in your damn lip, right? Because
Exactly.
when they get so big and they get so stretched, and it's just like, whoa. And I think that because of like how it had been like with the Kardashians and all this stuff. So all the things that people were doing like in the 2015s or whatever, getting the big butts and all this stuff. Have you noticed that all those people are getting everything dissolved and everything removed?
Yes.
And I think it's just this oversaturation where now people are like, I just want to be a better more improved, healthier, happier version of myself. I don't want to look like someone else.
Right.
And have you noticed that in the aesthetic world, everybody's face looks the same? Like all these women, they all have the same look, the same lips, the same chins, everything. And it's like, you lose who you are as a person.
Exactly. Yeah.
And I love that you're so conservative with
Yes,
that.
I'm kind of conservative in it, don't take it otherwise. Filler has its own place, and I
Yes.
will do that. We do it full facial balancing with filler and thread.
Yes.
Now that I have the eye laser, I try to, because it's more like, not putting anything, many of my patients do not want to have filler. So I have this tool to improve their skin quality. Laxity, double chin. So I do have my fillers in my toolbox, not the first one to go for it.
But you don't use it in the way where so many of these other injectable doctors and nurses have been doing it for so long, where they're just like making people, it's just so over exaggerated.
Right. But they also, I think they're also doing it now, knowing the industry, knowing the trend. I think they're also doing it facial balancing.
Yes.
It was, everybody looked the same because there is no facial balancing.
Yes.
Right? If we use the cookie cutter method to everyone, how you gonna look to yourself?
100%.
Right? So you can do facial balancing, and you use all the tools that you have to make that facial balancing.
Right, right. And that's what I think is so important. And that's why I love what you do. And this is a hill that I will die on. You are one of the best providers I've ever met and I've ever worked with. And I'm not just saying that because I love you. Yeah. I mean that.
I know that. I'm learning. I'm always in a mode of learning and getting the natural outcome of the treatment. That I think that's the best. You do everything that needed to be done, but still be yourself.
Every time I talk to Dr. Sazia when we're doing our business coaching, she's always like, oh, I can't do coaching on this day because I have to go here because I'm going to this conference and I'm learning this. And I'm like, you're freaking amazing. Yeah. I don't know a lot of people that do that. So
without learning, without learning, again, it's a constant changing environment, and you need to know. And I wish I have affordability to get every devices in the world, but that doesn't work. You work with the device that you have. And I think I have the pretty amazing devices in my practice. Yeah, exactly. And, it's just right path, right time. But again, if I do, even for Katie, if I do eye laser and she doesn't take care of herself, that's not going to show any results. 100%. So I have my responsibility, and you as a patient have responsibility as well.
Absolutely. So the last thing I want to talk to you about, this is for our listeners and our viewers, is so important, is a lot of people say, okay, Dr. Sazia, that's all great. And, Katie's a rich bitch and she can afford all this. But the great part is you have a membership.
I do. Yes.
And which is so genius. And honestly, I'm not trying to say what you should do for your business, but if you have a practice out there, whether it's, aesthetics, facials, even lashes, any of this type of stuff, these memberships are so amazing because if they don't use it, it rolls over. Yes. So they're not losing money.
No.
So we were talking one day about a client that we both know, and the person's like, I feel so bad. I haven't seen Dr. Sazia in 6 months. I've been so busy and I've been traveling. And I said, who cares? They're like, what do you mean? I go, you're not losing the money in your membership. And they're like, oh my God, I totally forgot.
Right. Yes.
So let's just say, for example, you want to do eye laser.
Right.
And you don't come to Dr. Sazia for a couple months. All that money just rolls over. You can take that money and put it towards eye laser or, threads or anything, CO2 or whatever.
Anything. And you get, as a member, if membership, we have 5 services that you can do one per month. But other than if you haven't been coming to the clinic for a year and you acquire like $3,000 and you choose to do eye laser, you get 15% on top of it.
That's awesome.
So, yeah.
That's so smart.
I think I remember who you were talking about, and she hasn't been in the clinic, and she has RF microneedling, which is $950 probably each. And she has money sitting, and she had done 2 sessions without putting an extra money.
See, I love this. Yes. This is so good. Anything else you want to tell our viewers and listeners out there? Because we covered a lot today.
I know. I wanted to, say to everyone that listen to your body. Perimenopause can happen 10 years earlier than your actual menopause. So if you are experiencing any of the symptoms and your provider is not helping you, reach out. There are a lot of other providers out there are waiting to help you. We have now tools. We do not have the, the risk of not treating, risk of not treating you is the higher than risk of treating you. So, and you have to treat yourself from inside and always, outside as well. So it's a combination will make you who you are and make you, a confident woman. So
Amen.
we are here. I'm here, I will listen. Maybe not everything for everyone, but there always something for you.
100%. I love it. Now, if people mention Ambitchious in the Meno Reno and they reach out to you on your website, which by the way, all of this information, guys, will be in the show notes. So wherever you're listening to this podcast, just scroll down to the show notes and Dr. Sazia's information will be there, her website, so you can contact her. You do both in-house and virtual consultations.
Yes.
So people don't have to live in Windham, New Hampshire to go and see you, right? They can be from everywhere.
Right.
So you do that. And if they mention the Meno Reno and Ambitchious, they get 15% off.
Right. 15% off their any aesthetic services.
Awesome.
Yeah.
That's awesome. Dr. Sazia, thank you.
Thank you, Katie.
I love you so much. My hands are so cold.
Oh my God.
I know.
Cold.
I'm always cold. It's because I have a warm heart.
I say the same thing.
But this was so amazing. I wish I could talk to you for 10 hours straight because you're so freaking smart and you know everything and you take care of this little chin. God help us. I will also be, for going forward, we're going to be also on social media doing all the Meno Reno. So you'll get to see all this, all this stuff happening in real time. Because one thing people say to me all the time, like, oh my God, you're so crazy. You just like put yourself out there. I'm like, yeah, I want people to see, like, I'm a normal person. I go and get these things done. It doesn't hurt. It's not that big of a deal. And I think the more knowledge you have, the less you're nervous about things.
Exactly.
And it's not that big of a deal.
Right.
You know,
knowledge is power.
Amen, sister. Thank you so much for being here.
Thank you so much.
I love you so much. And I know that all of my girls out there in Ambitchious Land are going to love you just as much as I do. And in the meantime, don't forget to stay ambitious. And I'll see you next Tuesday.
How long I talk.